Welcome to the SmartFlow podcast presented by Jotform, where we feature top leaders sharing their smart solutions in business and life.
Hi, Chad Franzen here. I am one of the hosts of the SmartFlow podcast, where we feature top leaders in healthcare. SmartFlow podcast is presented by Jotform Enterprise, which is a HIPAA-friendly no-code platform that empowers healthcare organizations worldwide through custom forms, e-signatures, and more. Their solutions enhance patient and provider experiences by streamlining intakes and automating administrative tasks, all in a secure environment. A great example is Body Brave. They consolidated 5 separate platforms and replaced them with Jotform Enterprise. They obviously saved money, but also saved 120 hours of staff time in the first 6 months with Jotform's data collection and reporting tools. Popular use cases for healthcare organizations include digitizing forms, replacing paper-based processes, collecting e-signatures, and much more, so they can ultimately focus on delivering exceptional care. It's also very easy to implement. I've even used it myself, so that shows you it's really easy for somebody who's not technically minded. Learn more by going to jotform.com/enterprise. My guest today is Dion Lampy, Chief Marketing Officer at TotalCare Emergency Room. Dion has held this position since April 2023, following his tenure as Senior Director of Community Liaisons at TotalCare. His career in healthcare leadership spans a variety of roles, including CEO of North Texas Regional EMS and Director of Business Development at both DFW Emergency Medical Services and Allegiance Ambulance. At TotalCare Emergency Room, Dion oversees marketing and community engagement for a network of 14 facilities across North Texas, which includes emergency rooms, primary care, urgent care, and behavioral health clinics. TotalCare is a faith-based, family-owned organization with a mission to provide individualized, high-quality care to the communities it serves. Under Dion's leadership, the organization has expanded its charitable initiatives, supporting clinics internationally and partnering with local nonprofits and churches to deliver healthcare and community services. Dion, it's great to talk to you today. How are you?
I'm good. How are you doing today?
Good, thanks. Appreciate you joining me. Hey, tell me as we get into it here, what kind of drew you to the healthcare industry, and how did your career path lead you to become, Chief Marketing Officer at TotalCare?
Honestly, what drew me in, I started marketing really kind of right out of college, but going through different avenues, I went into healthcare staffing with a company called Martin Fletcher a little while back, and then it just really drew me into wanting to stay into healthcare. So had an opportunity to start marketing for EMS companies, and just over the years, really kind of went from one to the next and got promoted and kept moving up the chain. And then I got to a point where, you know what, I think I'm going to open my own, and was able to do that. Worked with freestanding markets across the DFW. And once I sold my portion of that EMS company, I went in and really kind of was a consultant for a lot of the freestanding emergency rooms that opened in the DFW market. And then later on consulted for TotalCare for about 2 or 3 months. And they talked me into closing my company up and coming on full time for them.
Okay, very nice. So tell me a little bit more about TotalCare. I mean, the name is TotalCare Emergency Room. Just kind of tell me maybe what it would be if I walked into the doors for the first time.
So TotalCare emergency rooms are full concierge level emergency rooms. You will see an emergency room physician within 5 minutes of the time you walk in the door. If you're having serious chest pains or different things, it's immediately walking right back to the room to go back. We don't see the mass amounts of patients like a hospital emergency room does. So you are really seen as an individual when you come in, and you're seen very quickly with board certified physicians and nurses.
So tell me about what kind of your role as Chief Marketing Officer in a place like that, TotalCare Emergency Room.
Yeah, I think the biggest challenge here is just getting to the public to know who we are and what we do. We're often confused as a urgent care, or a lot of negative responses will be a doc in a box, but we are so far away from that. We are a full service emergency room where we do exactly the same thing as an emergency room, let's say at a big hospital system. The only difference is when they admit the patient, they roll them up into the room. We admit the patient and we have an EMS company that comes and picks them up and rolls them up into the room. So that is really the only difference in what we do than what they do. Um, the other aspect is we're privately owned. So we're not inside of a full system like some of the big hospital systems are. So you get the concierge treatment, and you also get the same exact treatment as you would going somewhere else, but a higher level and a
Sure.
one-on-one service.
So given the choices, are those that's maybe a reason why I might choose if I need an emergency room to go to Total Care?
Absolutely. Now, one of the things we don't participate into the governmental insurance like Medicare, Medicaid, or TRICARE. One of the reasons why we don't is we're not a part of the big hospital systems. But we do take all commercial insurances. So if you have commercial insurance and you need an emergency room, I mean, there's really no reason why you wouldn't want to choose us as your place to go. And we're fairly close. We have 10 ERs around the Metroplex, and we're growing as we speak. So
When I introduced you, I mentioned that Total Care is a faith-based organization. Tell me kind of two things. First, how does that impact the way care is delivered to patients? And then I'll ask how it affects marketing.
yeah, I think the care when it comes to the patients is we go the second mile for our patients, and how we treat our patients, it really goes back to our faith and how we treat each other and where we are. Our culture is very different. We have a very strong culture within our company. Patients come first. This is very different than what you would see maybe in other freestandings or other competitors' side. They do give great care. Don't get me wrong, but with us, we back our care with our faith and what we believe we need to do on that aspect. For me, it is I came as a consultant because I was tired of the typical ownerships of freestandings and other agencies in the healthcare. I decided to close my consultant company up and come full time because of the faith and because of the ownership. We're privately owned by a family that is based in their faith, and they grow these buildings for the sole fact of doing more things worldwide in the face. So for me, it's growing. My job here is to grow our profit centers
Mhm.
and to really make sure everybody understands who we are out in the field, so that way we can grow our nonprofit side of things.
So when you go into a restaurant, you can pretty quickly get a feel for like the culture of the restaurant and the staff or whatever.
Uh,
How could I recognize the unique culture within Total Care if I was,
I tell
there?
you that the very first thing you're going to see when you walk into any one of our emergency rooms or clinics is a Bible on the wall,
Hmm.
and it's opened up. So it is a cornerstone of who we are. And then you're going to see the great first concierge treatment at the front desk and back when you go back and see a nurse and a physician. If you are going through a very, very hard time, they will ask you, do you want us to pray with you? Are you comfortable with that or not? That's fine. We get it. But we will be here. If it's a challenging time in the ER and you're going home with some challenging news, we will definitely be that that faith around you and help you guide you through that in every step of the way. So I think it's just a one-on-one care that you get from us. And you you get the above the second mile service from us. So I think that's where we really shine and do things differently.
I know I think you guys are supported or involved with the Total Care Foundation. Tell
Sure.
me a little bit about that and how that extends the organization's
Sure.
impact.
About right before COVID, the our brothers, the Sade family, they purchased an emergency room in Benbrook, the first one, and the sole reason why they had primary cares for the last 20 years in South Fort Worth area. Um, it just didn't make enough profit to be able to do more of what they wanted to do worldwide, and that's to help people and heal people. So they bought the emergency room in the sole reason to a little bit more profit. Well, COVID came, and then after COVID, they decided to expand, and that's where I came aboard and expanded to two buildings, and then we expanded six more after that. And the reason behind this is that so we can really help those at disadvantage in areas of the world that don't get a lot of help. Our mission right now of who we are is to heal, whether it's through faith, psychology, through just a helping hand, or we put a band-aid on something, or maybe we are able to heal or help something in your everyday life that might be. So that's where we are. We're here to heal people, and not figuratively. As an emergency room, we don't really heal people, but what we do is we get them on the right track to be able to heal either emotionally, spiritually, or just regularly through what's going on with them.
I'm guessing, providing that kind of medical service is a huge responsibility, but also, representing your faith in that way in front of these patients every day is also a big responsibility that you guys probably take very seriously.
It is, and I think that our culture, we have done a really great job of being a very small company, keeping a very tight culture, and then growing and stopping our growth for 2 years, grow our culture really well. And now, after 2 years of our culture being very strong and have a good base, we are now moving to another big expansion. And so, having a really good base in our culture and our value system of what we do across all of our levels, I think that is the biggest key. And our executive team has done an amazing job of keeping our culture and our values out in the forefront of what we do every day.
So, how does a big expansion affect your job?
Wow. My job just got very complicated for the next 2 years. So we in December of this last year, as I was coming back from our mission trip to one of our areas, Mauritania, I came back and landed and was told by our CEO, "Hey, our owners want to double in size in the next 2 years." So they're in the next month they're gonna list several facilities to go after, and they're gonna start going after. As of right now, we are looking to be at add five more facilities by the end of the year. By the first quarter of 2026, we are looking to build and have brand new facilities out in areas that need it. So possibly three more, and then also maybe acquiring and moving into different cities as that come along. So um, all of that means that new marketing people out in the field, really raising our game on the Google displays, social media, all of that aspect of really pushing that out and launching a major campaign in July, which we are finalizing a major campaign in the Dallas Fort Worth market that will entail all sources of media, and that should roll out July 1. So we're excited about that. But all of those things are all moving factors. Opening brand new buildings in new territories always is a challenge as well. So
Have you noticed maybe the community response to Total Care's mission and services? I'm guessing it's been positive if you're doubling your
it
efforts.
it has, and I think my biggest shock really as I came into this is when I went out, I was a little timid in saying, "Hey, Total Care is a faith-based company." I didn't know what the response would be. And then once I said it, and then people asked questions, and I got to tell them about who we are as a culture, that all of a sudden more and more businesses would come up as, we align just like you guys. We align just like you. They don't really, a lot of companies are afraid to put it out there. And there is way more companies than you would remotely think about that really align in their faith and really do an amazing job on servant leadership and doing the things for the clients and customers. And so that's been a shock to me, but it's been a really good, heartwarming feeling because, we don't shy away from this and we will not. And we love to partner with those that have the same mindset and really kind of put their faith out there like that as well.
Have you heard maybe how somebody who, let's say you get somebody in there and they don't prioritize like faith in God in their life or whatever, but then they're asked if they wanted to be prayed with. What's kind of a typical response from somebody like that? They just say
You
yes or
know,
no, or
uh, some of it, it kind of goes all around the streams, but there are a lot of times when they say no, no, thank you, and then okay, we're great. We'll help you in this, and then in the end, well, if you don't mind, I wouldn't mind that if you'd
oh
like
yeah,
to. And so I think it's a shock to the system, to be honest. And also, we are not pushy. We're hey, would you like this? No, okay, then we go and keep treating you exactly the way we would every other patient. In the foremost, highest level of treatment we could. And it's shocking to the system that you're not really trying to convert me. You're not trying to do this. You're not trying to do that. No, we just want to be here for you if you need it,
hmm.
and we want to help you through whatever challenge you may be going through. So.
Does Total Care try to address the needs of maybe underserved populations?
We do. And so we do have two behavior health that we do work on in downtown Fort Worth and up in the Argyle side of things. In the DFW area alone, the marketing team we try to do a volunteer basis somewhere inside of any one of our territories. We volunteer our time for half a day or so. We also have an initiative um, uh, that we give back to our communities. Every one of our divisions has every quarter needs to or wants to plan a something in the areas of the needy in the DFW area, and we're given funds to be able to do that. We're the facilities or the different teams are able to go out. We even offer some time off to do volunteerism and pay for that time off. So up to 8 hours a year to be able to do it on their own time because we want to encourage them to whatever you feel very comfortable in and volunteering, please do. So we've done a lot at the bridge in Fort Worth, feeding those that are out there, homeless and need help. We've done a lot there and up in Denton as well, several different avenues there. So really across the board, every projects go from help building houses for Habitat for Humanity to volunteering down at the bridge to doing soup kitchens down in downtown Dallas as well. So I mean, I think there's so many different volunteer efforts that we try to do here. It's really neat because that's our culture. Um,
Very nice. Very nice. Hey, I have one more question for you, but first, tell me how people can find out more about Total Care Emergency Room.
yeah, come to www.totalcare.us. That website will be able to get to tell you a lot more about Total Care. You can also get on the Total Care Foundation website from there. And again, the foundation is in three countries right now: Mauritania with two hospitals, Lebanon. We have a clinic in Beirut, Lebanon.
Hmm.
We also have about 250 employees in Beirut that does all of our back end work. And then we also have a clinic in Kenya, Eldoret, Kenya, and we do work with children with heart defects in Uganda. So we try to spread a lot of that around from the foundation, but you'll be able to find a lot more about that there.
Nice. Wow, that is really awesome. Hey, last question for you. So, how do you kind of measure success in your role as Chief Marketing Officer?
So really, there's two avenues of success. I think the first avenue, obviously, is just plain numbers, right? It's the number of patients that come in and are treated inside of our emergency room. So for me, um, what do we see? How many patients do we see on a daily basis? So really, if it really boils down to that end, it's a number basis. But the other aspect too is what the community is talking about and how the community sees and views us, and how much interactions we have with the community on a daily basis. And so I get to go out with my marketers that are out in the field every once in a while and do an event, and I overwhelmingly hear, "Oh my gosh, you guys are amazing! Oh my gosh, they're amazing!" I mean, we reached 10,000 five-star Google reviews a couple of months ago, which is a huge, huge compliment to what we do. And that's just within the last 4 years. So that sheds a light a little bit more that people are talking about us and really seeing what we're doing.
Okay, awesome. Hey, Dion, it's been great to talk to you. It's been great to find out more about you and also more about TotalCare. Really appreciate you sharing your time.
You bet. Thank you. I appreciate it.
Thank you. So long, everybody.
Thanks for listening to the SmartFlow podcast. We'll see you again next time. Be sure to click subscribe to get future episodes and go to jotform.com/enterprise to learn more.